Good evening, and welcome to Future Choices. My name is Fran Snedeker, and I am the producer and moderator of this educational series exploring reproductive health issues. This episode of Future Choices was inspired by an email I recently received from Planned Parenthood. It was entitled, "What if Planned Parenthood Hudson Peconic Closed?" Perhaps you received the same message. Today, with my handy-dandy flip video camera in hand, I invite you to join me to visit 5 knowledgeable Westchester neighbors to get their take on that all-important question.
Well, it would be such a loss for so many people and of all ages and families of all stripes, because I think that I don't know about the numbers of the people who use Planned Parenthood, but from my perspective, not having, as I called it, that safety net would be devastating.
Okay, 1 out of 4 women in the country at one time or another have received services from Planned Parenthood. That's pretty significant. But for us here in Westchester County, it's that 35,000 people, variety of medical services, the education programs not being replaced by anybody else. Without it, I think people would suffer. It comes to that.
Whether we're here or not, that doesn't mean teens stop having sex. It means we're helping them by being in this community, stay safe and stay free from pregnancies that they may not wish at this time.
Where we would see women end up going, as we have seen nationwide, whenever any kind of neighborhood clinic is closed, we see people using their emergency rooms in their hospitals, which, as we know, is possibly, I think it is, the most expensive form of medical care that can be provided, is through an emergency room for non-emergency care.
For me, it would be absolutely heartbreaking on so many levels. Just the education alone, so many parents within Westchester communities rely on Planned Parenthood for education, and so that would all be gone.
And personally, before I was even a professional, I have had interest and have supported Planned Parenthood, since way back in college days. But as a doctor, I feel like Planned Parenthood is really my safety net, because what I do is adolescent medicine, so I'm trained to manage a lot of the issues that Planned Parenthood is expert at. And what I find so helpful and so important with Planned Parenthood is that they are this incredibly reliable source for me of care that is confidential and accessible and affordable for a lot of my patients who may not be able to get the care that they needed in my office for reasons of confidentiality or cost. And so for me, I will often give the name of Planned Parenthood to my patients who really need a different kind of care, but one that I completely endorse and know is going to be the quality that I want for my patients. I've sent couples to Planned Parenthood on a number of occasions, suggested that they go together.
Because?
Well, whether it's for birth control counseling or termination of a diagnosis or termination of a pregnancy or management of a pregnancy, it's really a very wonderful thing if they can go together, and I know that Planned Parenthood is welcoming of that in a way that a gynecologist's office might not be.
Sure. We touch base with tons of teens. Actually, last year alone, we reached out to 35,000 people with our education programs. So that's letting people know about basic human anatomy. It's teaching parent-child communication skills. And for teens and adults as well, sometimes it's kind of a shameful thing to think, I should probably know this, but I don't. And so that's where education really plays an important role, because we're talking about saving lives when we talk about safer sex. Westchester County alone last year, I think 2009 actually is the most recent data that we have, 120 people were newly diagnosed with actually AIDS at that point. And so that's here in our county, that's here in our local community. So when we talk about Planned Parenthood doing HIV testing, teaching what is HIV, what is AIDS, how do you keep yourself safe if you're engaging, and we include the message that abstinence for teens is the 100% way to ensure you're safe from STIs and STDs, and that you don't contract a pregnancy that's too early, untimed, unwanted, or what have you. So we teach that, and then we teach if you are having sex, this is how you keep yourself safe.
What are the services that you most respect?
Number one, education. It's Planned Parenthood, as a national affiliation, is 90 years old, older than me. And it's been doing this for all over the country successfully. And they do a tremendous amount of education in the schools now, which are tremendously important. It was not available for me when I went to Scarsdale High School those many years ago.
Planned Parenthood is used primarily for everything from prenatal counseling to postnatal counseling to family planning services, pap smears, mammograms, and most women I know, if you ask them what they think of Planned Parenthood, their first answer is, "Oh, it's a great place. It's until I had a child, that's exactly where I would go for all of my yearly exams, et cetera, until it became necessary to have an OBGYN of your own." And that's what they serve for this county, and they're a huge asset. Also, because Westchester County doesn't deliver, the county has gotten out of hands-on healthcare delivery.
I think one of the most important things for me, again, personally, is sexuality education. I've been ordained in the United Church of Christ for over 10 years now and have served two different churches in Westchester. I used to be the Associate Minister for Families at the Congregational Church in Chappaqua. And then moving to White Plains as the pastor of the church in the Highlands, I see how Planned Parenthood really impacts the lives of youth within both of these communities and throughout Westchester. They provide so many services for high school students, and I think that the most important one is really the education that they provide. I recently completed my doctoral work in the circle of pastoral counseling, and really went from the perspective of how do faith communities develop healthy communities in terms of sexuality. And so what I discovered in the course of that study is that nobody does it better than Planned Parenthood.
We do so much, not only here in our location, to do education programs for parents and for their teens as well. We're in schools. A lot of health teachers may not know the latest information about what's, the latest about sex and sexuality, and so they'll say, "Hey, do you guys mind coming in and helping out with some of the sex education stuff?" So we do that in schools. We're also, we come to teens where they are, and so via our Smart Wills program, we take education out on the road, and so we go to different locations, we're at health fairs and different places where people want to know information about sex education. The community centers, community-based organizations, we're available to faith-based organizations, anyone who wants to make sure that teens are safe, and if they are having sex, and not all teens are, if they are, they're safe, and if they want more information about abstinence, we give that to them as well. We know from the national campaign to prevent unwanted and teen pregnancy that 80% of teens say they wish they could talk to their parents about sexual behavior, sexual activities, STIs, STDs, preventing pregnancy. Like, they wish that they had more of an ability to talk to their parents about these issues. So we actually offer parent-child communication courses that help teens and their parents have better, healthy communication about sex.
And there's really no reason for faith communities to sort of reinvent the wheel when we have this great resource within our community that we can call upon. So I've really encouraged churches to pick up the phone, to call their local Planned Parenthood and say, "Hey, we've got parents who want to talk to their kids about sex and sexuality issues. They just don't know how to do it. So could you come and talk to our parents within our churches about how to best do this? And then we can continue that conversation and talk about the theological piece, which certainly they don't do, but the information that they provide is so crucial to healthy sexual development.
Planned Parenthood provides a very, very valuable service in Westchester County as a delivery system for women's reproductive health, basically.
Reproductive health being?
Reproductive health, everything having to do with women's reproductive systems. And they provide the prenatal counseling, they provide birth control counseling, they can provide birth control, they handle mammograms, pap smears, any kind of questioning that young women, old women, any women who are of reproductive years have. And this is very vital in Westchester County because the county is not in the position of, the county's Department of Health does not provide necessarily this kind of hands-on treatment, hands-on counseling. And it's really up to our neighborhood health clinics and including Planned Parenthood to be able to provide this one-on-one type of service.
And what is it that Planned Parenthood can do that in its clinic setup that talented private practitioner such as yourself couldn't do just as well? Or
Well, thank you. But you know what? One of the great things about Planned Parenthood is that what they do is what they do all the time, and they are expert in their field. They are, up to date with the latest information. They information and techniques and technology. So I know that if I send a patient to them, they're going to get the best care. And the other thing that Planned Parenthood can do that we in private practice in Westchester cannot do is they can function the way some of the best clinics and the teaching hospitals do, in that they have all the ancillary services, the social workers and nurse practitioners and physicians all working together, not to mention the administrative people who are keyed into these patients and understand what they're coming for, understand what the legal aspects of what they're doing are. And so that is something that we don't often find in a private practice setting. And I would emphasize that social work element where, the support and counseling that a lot of times needs to go along with taking care of adolescents, we just don't have in private practice.
We really are a source of medically accurate, scientific, age-appropriate, correct information about sexuality. So tons of myths out there. So the withdrawal method, or teens call it pulling out. If he pulls out, I won't become pregnant. I'll be safe. You can still contract an STI. You can still become pregnant. And so tons of myths out there that teens have about sexuality.
But my perception, certainly I'm not in the field of adolescence, is that social worker, that's the last person that they want to talk to.
Not at all. A lot of people who ask me why I do adolescent medicine, say that they don't talk, they just shrug. But that's just not true. If the setting is correct and the assurances of confidentiality are there and the privacy issues have been addressed, and that's what I do in my work, that's what they do at Planned Parenthood, and kids love to talk, and they want to talk, and they need support. It's about who's listening, and how they're listening, and how they're asking the questions as well, and in what kind of a setting. And so, that's why they don't talk to a lot of people, including many, many doctors, because we don't realize that they need to have this set up in order to feel very comfortable and then to divulge whatever it is that they need to talk about. Sometimes it's secret or private, and sometimes it's not at all, but they just need to be sure that they're going to be talking in a non-judgmental setting.
Yeah, one of the things that I really want our teens and everyone actually, everyone who practices safe and healthy sex to know, it's that sex education and sex information is just part of a whole body of wellness information. So your sexuality is not that different from any other part of your body. So if you wanted to know more information about how do we keep our eyes safe and how do we make sure that our hearing is good and how do we make sure that we're eating healthy foods, it's all health information, and keeping our sex organs safe and free from infection is part of our health, just general health. And so I don't think there's any need for stigma for seeking out that information. Even if you're not sexually active now, there may be a teen who isn't sexually active now but wants to know when they make that decision later in life, what do they need to know about keeping themselves safe? How does pregnancy work? Because like you may feel like, oh, I'm silly if I ask, like how do people get pregnant? I mean, if you have sex, but like, do you always have to use protection? How? When? All these questions they ask us, and we give them medically accurate information about that.
So we actually had a whole weekend retreat addressing the issues of sexuality where we talked with parents about values development and how their faith informs their values development around issues of sexuality, and then had Planned Parenthood come the next day to talk to the kids about sexuality education.
And clarify for me why, from a religious perspective, you view sexuality education as such a key component?
God created us. Genesis, the story in Genesis, the creation myth says that God created us and declared it good. And it is good, and part of that goodness is the gift of sexuality. And churches have done a horrible job in the past talking about sexuality. And many mainline churches are sort of reclaiming the prophetic voice around issues of sexuality, including the marriage equality issue within New York State. We're talking about LGBTQ issues. We're talking about how the church can be faithful in addressing bullying within schools around these issues. And so there's really a lot of work right now going on. And again, it's about looking at some of the negative texts within Scripture that the church for so long has used to justify exclusion, and even in some cases violence and hatred of a certain population. We're looking at those texts anew, looking at the original context, what they really meant during that time, and saying, let's look at these in a different way, and let's reach out to the LGBTQ community in new ways, in inclusive ways, in ways of love and acceptance.
So, just to sum up, let's go back to my initial question. What would happen to these people with whom you interact, these young adults, these teens, if Planned Parenthood were defunded and had to close their doors?
Absolutely. Planned Parenthood is in the community because we're servicing the needs of the community. So if our doors were shuttered, those needs don't go away. So for example, say last year alone, we did 54,000 STI testing and treatments.
Wow.
54,000. So if Planned Parenthood's not here, that doesn't mean that there's no STI and STD. It means that one of the main providers of that service in the community is gone. And for STIs in particular, we know that if they're left untreated for a long period of time, so for example, if it spreads from up into the uterus through the fallopian tubes and towards the ovaries, that can actually, that's pelvic inflammatory disease, which could cause infertility among teens and women as well. And so that need's still there, and the STIs need to be treated. Medically accurate, age-appropriate sex education still needs to be out there. We reached 35,000 people with such programs last year alone. And so if we're gone, those needs are still there, and that just means that by attempting to shutter the doors of Planned Parenthood, you're shutting out one of the main providers of education and medical services for the community.
They serve a lot of people, a lot of people, 35,000 a year. And, over a number of years, that adds up. And largely, but not entirely, relatively low-income people. I think the figure nationwide is something like 75% of the people below the poverty line That's a service that nobody else is doing. And for many people, Planned Parenthood is, in effect, a primary physician. I mean, if you're Medicaid eligible and you're 25 years old and you live in Westchester County and you had a routine test, maybe even a blood pressure test, it was probably done at Planned Parenthood. Nobody else is doing it. And nobody else is providing those kinds of services for that population.
You mentioned also that you often send a patient. Do your patients range in what age?
My patients range from 10 to 26.
Okay.
Most of them are, I would say, 17 to 22, maybe 15 to 22,
Okay.
actually.
So still officially minors. And,
Yes.
and you said something about you sent them to many of them to Planned Parenthood because of the confidentiality issue.
Well, you know, in New York State, minors have a right to confidential medical care with respect to reproductive rights and sexuality, which means that they can receive care without permission from parents. That includes counseling, treatment for STDs, birth control, and termination of pregnancy. So, my goal with my patients is to foster a relationship between parents and children and young adults so that there's open communication and there's also respect for privacy. But sometimes that's just not possible. And sometimes the privacy issues are such that they need a place like Planned Parenthood that I can endorse for them and tell them, look, I know you're going to get good care here. This is where you need to go now. For services that I can't provide or for services that I can't provide in a way that I can assure them is going to be private. With insurance being what it is now, for instance, say with laboratory tests, I can't really guarantee my patients that a bill's not going to come home with the name of the test on it, that a mother's not going to open that letter, depending on who holds the insurance card. So I'm very careful about that. And I tell them, look, if this could be an issue for you, then I really won't do the test here, and I need to send you to some place that can do it with, without that intervention. So even people with insurance sometimes need to have that kind of medical care that is really quality, but also confidential and private.
So with that background, Anne, tell me, what do you think would happen to us here in Westchester County, one of the richest counties in the nation, if Planned Parenthood were defunded by Congress, were deemed to no longer be eligible for federal dollars, and therefore had to close their doors in Westchester County? What would happen to your people?
I think I said at the beginning that I see Planned Parenthood as a professional safety net for my work. How can I guarantee or promise or promote safe, confidential, quality, private, comprehensive medical care for my patients if I don't have Planned Parenthood as my backup for those who can't afford what I do, for those who need to have access to services without their parents' knowledge, for those who can't afford the medications that I might want to prescribe? How would I practice? It would make a huge impact on me.
Planned Parenthood Hudson Peconic has been able to, because of its community support, because of its good record, and because of the services it provides, been able to generate some private contributions. We would probably survive. But there are, I think, 80 affiliates nationwide, and some of them in some really challenged areas of the country, they would go out of business. And that would be extremely unfortunate for that population. We would, if we lost any source of federal funding, then our services would be profoundly restricted. There's no question about it. They would not be able to provide a lot of these services for people who really need it, and nobody else is doing it. Nobody else is doing it. If there was somebody else out there to do it just as well, I'd be fine. But it's not happening. So yeah, that would be a tremendous burden on people who could not afford it.
It saves tax dollars, it saves hospital costs, it keeps people out of emergency rooms when they don't need emergency care, Planned Parenthood serves the same function that all of our neighborhood health clinics do, where they can take care of the more basic health needs of our residents in a very, very effective and efficient manner.
We talk about one thing. We always talk about costs. You know, we're driven now by a notion of costs, but there's always a line underneath the bottom line, and sometimes there's 2 or 3 lines underneath the bottom line. It's cost avoidance. Cost avoidance. If we can, you know, if you can provide education to teenagers, if you can do pregnancy screening and testing, if you can do cancer screening and testing, then ultimately you save money down the line. So, you know, what are we really saving here by doing this? If you try, if you argue that we're not going to fund, the government should not be funding Planned Parenthood because this is a way of avoiding the deficit, I mean, that's a crazy argument.
For me, it would be absolutely heartbreaking on so many levels. Just the education alone. So many parents within Westchester communities rely on Planned Parenthood for education, and so that would all be gone. And that's just one thing that Planned Parenthood does. In terms of providing services for poor women here in Westchester, all of those services would be gone. And again, it's not just about access to abortion. It's about cancer screenings. It's about breast exams. It's about contraception. So many women living in poverty get contraception from Planned Parenthood. And when you think about it, the cost of an unintended pregnancy for New York State is 4 times that of cost of contraception. So it really, fiscally, it doesn't make any sense to defund Planned Parenthood when every dollar you spend on family planning saves you $4 in the same fiscal year. But it's so much deeper than that. It's about justice. It's about maintaining access for women living in poverty. I mean, let's face it, women of wealth have always had access to any reproductive health care services they need. It's women and children living in poverty that really suffer from any kind of budget cuts. And if Planned Parenthood were to disappear, women living in poverty in Westchester would be really cut off in terms of family planning access.